Today's class is Hodgkin's disease part 2. Today we will see staging of Hodgkin's disease and a staging classification for Hodgkin's disease. Stage 1, involvement of single lymph node region or of a single extra lymphatic organ or site, that indicate 1E. Stage 2, involvement of two or more lymph node regions on the same side of the diaphragm represented by 2, or localized involvement of extra lymphatic organ or site and of one or more lymph node regions on the same side of the diaphragm represented by 2E. Stage 3, involvement of lymph nodes on both sides of the diaphragm indicated by 3. There may also be splenic involvement represented by 3S or localized involvement of extra lymphatic organ or site represented by 3E. Stage 4, involvement of extranodal sites other than by direct invasion from an affected node with or without lymph node involvement. For each stage, a qualifier A or B is used. A denotes the absence and B the presence of typical symptoms include weight loss, fever and drenching night sweats. Hematology. The blood count is usually normal. Patients with systemic symptoms or widespread disease have anemia and a raised ESR, both of which indicate a worse prognosis. A reactive leukocytosis indicates very active disease or tissue necrosis. Lymphopenia is a poor prognostic sign. Moderate eosinophilia is occasionally found, but it is of no particular significance. Bone marrow involvement occurs in only a small percentage of cases. Simple aspiration smears are less likely to reveal infiltration with Hodgkin's disease. Biochemistry. Abnormalities of liver function may reflect liver involvement but are not diagnostic. Isolated increases in serum alkaline phosphatase or a raised serum calcium may point to bone involvement. Skeletal MRI may be helpful in such cases if bone marrow examination is negative. Chest radiograph. Assessment of the amount of mediastinal disease, hilar node and parenchymal lung involvement is important as it indicates an adverse prognosis. Computed tomography, CT scan, positron emission tomography, PET scan shows the areas of malignancy in the body. Fine needle aspiration, FNA biopsy, excisional or incisional biopsy, bone marrow aspiration and biopsy, chest or abdominal fluid examination are also done. Treatment. Stage 1A and 2A. The treatment of choice for most adult patients with stages 1A and 2A is radiotherapy. Stages 1B and 2B are best treated with chemotherapy from the outset. Stage 3A. Radiotherapy should be confined to patients with pathologically staged 3A disease, that is, those who have undergone laparotomy and splenectomy, but many centers now favor chemotherapy for all patients with clinical stage 3 disease. Stage 3B, 4A and 4B patients with advanced disease should be treated with combination of chemotherapy. That's all about Hodgkin's disease. See you in the next class. Thank you for listening. Take care. Bye bye.